Okay, let's review the muscles that are responsible for radial carpal or wrist flexion. So wrist flexion is kind of the palm coming up towards your elbow joint. It occurs in the about the medial lateral axis in the sagittal plane. I just want to highlight that they are wrist flexors because they are anterior to the wrist joint, so that line of pull. And there's going to be a lot of muscles, but we can make them simple. And the majority of the wrist flexor muscles come off the medial epicondyle of the humerus, right? So we know we're on the medial side because this is the pinky side. And you can see all these muscles coming from the medial epicondyle coming down to either the radial or the ulnar side. Since they're anterior, they are responsible for wrist flexion. We're going to separate them into layers. And I just want to show you the first layer. The superficial layer has 3 muscles: flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. All right. Um, so we'll go over these in more detail. All right, some helpful hints for these wrist flexor muscles. Neural innervation. The forearm, right, the upper arm was musculocutaneous nerve, which split into the ulnar nerve and the radial nerve. All right, or I'm sorry, the ulnar nerve in pink here and the median nerve, which is on the radial side. So the ulnar nerve has very few muscles are innervated by them, and we will highlight them. The majority of the muscles in the forearm are innervated by the median nerve. All right, so there are many muscles anterior on the forearm, and since they're anterior, they are wrist flexors. So all of these muscles, but we're going to organize them from medial to lateral. So medial being ulnar side to the radial side, and then superficial to deep. So the most superficial we saw in the previous motion videos: flexor carpi ulnaris, palmaris longus, flexor carpi radialis. Then you go a little bit deeper to the middle. You have the flexor digitorum superficialis, right? Even though it goes to the digits and flexes the digits, it crosses the wrist joint, so it is a wrist flexor. The most deep is flexor digitorum profundus, right? If you have a superficialis, you probably have a profundus. And then flexor pollicis longus. Again, all of these cross anterior to the wrist joint, so they're all wrist flexors. Some helpful hints. The wrist flexors attach to the medial epicondyle of the humerus. If you just memorize that as their distal or proximal attachment, that saves a lot of time. Flexor digitorum superficialis attaches to the middle phalange, and therefore it flexes the wrist and the proximal interphalangeal joint. Flexor digitorum profundus goes all the way to the distal phalange. So it flexes the wrist and the distal interphalangeal and the proximal interphalangeal joints. And we'll look at the retinacula and the way these tendons are attached. It has a pretty interesting structure. All right, so let's review these muscles layer by layer. Again, remember, most attachments come off the medial epicondyle of the humerus for the wrist flexors or the anterior muscles. And then think about if it has radialis in its name, then it's going to go to the thumb side. And so, say, flexor carpi radialis is going to go to the second metacarpal. And if it's ulnar, it will go over towards the 5th metacarpal. So just logically think about where they are attaching. So here we see our pronator teres, our flexor carpi radialis, palmaris longus going into the retinacula, and then flexor carpi ulnaris. 2 things I want to just highlight, remember what a retinacula is. It's basically just a band of tissue that's holding these tendons down. Because all of these tendons, you can imagine if you flex your wrists, they would kind of pop out if not for this retinacula. So retinacula are very important at our wrist and at our ankle. The other thing is this is the flexor carpi ulnaris. Very close to it is the extensor carpi ulnaris. So we have to remember these are 3D models. So our flexor carpi ulnaris is going to be very close to the muscle belly of our extensor carpi ulnaris. They are median nerve innervation, this one, flexor carpi radialis. So let's go to palmaris longus. Palmaris longus, again, medial epicondyle of the humerus, going into the flexor retinacula. It only flexes the wrist. It is the median nerve innervation. Flexor carpi ulnaris, medial epicondyle of the humerus to the base of the fifth metacarpal, near the pisiform. This is ulnar nerve innervation. So remember, ulnaris, ulnar nerve, and it, since it's anterior, it is a wrist flexor. So those three are the first layer. The second layer is our flexor digitorum superficialis. Again, you can say it's coming off the medial epicondyle, and since it's flexor digitorum superficialis, it is going to the middle phalanges, median nerve. As we said, most of these anterior muscles will be median nerve innervation. And aside from wrist flexion, it also flexes the metacarpal phalangeal, or your knuckles, and the proximal interphalangeal joints. Just based on line of pull, those are going to be its functions. Third layer, the most deep layer, flexor digitorum profundus. Again, it's not quite coming off the medial epicondyle, although I think that's probably the best way to start to remember it. It's a little, it's down on the radius and the ulna, but it is going to the distal phalange. This one's interesting. The medial half is the ulnar nerve, lateral half is the median nerve. And again, based on line of pull, it's going to be a wrist flexor, a metacarpal phalangeal joint flexor, a proximal interphalangeal joint flexor, and a distal interphalangeal joint flexor. The other deep muscle is the flexor pollicis longus. Its function is in its name. It flexes the thumb, which is also called the pollicis, and it is median nerve innervation.